We're Harlem Health Advocacy Partner. We help with um, individual health coaching, group wellness. We have a quit smoking program. Our workshops are on Wednesdays at 11 a.m. through the Zoom kind of thing. And all of our services are free. If you have any problems with your health insurance or applying for SNAP benefits, we can also help with that.
So today, HHAP will be presenting on hypertension, which is also known as high blood pressure. So today we'll be going over the high blood pressure checklist. Starting off, we'll talk about what is hypertension. What are the heart disease risk factors, tips for controlling your blood pressure, knowing your numbers, monitoring your blood pressure, taking your medicine, signs of a heart attack and stroke, and also a heart healthy diet. To start off, what is blood pressure? All right, a lot of people, they don't have like a clear knowledge of what it is. It's basically, it is a force of blood against the walls of your arteries. As you can see on the right side, there's a picture of a blood vessel. On top is the systolic pressure. It's measured when your heart contracts. And on the bottom is the diastolic pressure. It's measured when the heart relaxes between the beats. Now, inside the blood vessel, as you can see, there are three stages. You have normal, you have prehypertension, and hypertension. Now, the difference between these three stages is that you can see the blood vessel walls, it starts narrowing more and more and more, where it will ultimately lead to hypertension. So what is high blood pressure? Hypertension. So high blood pressure means your heart has to pump harder than it should to get blood in all parts of your body. So on the left side, as you can see, we have a normal blood vessel where all the blood vessels are flowing perfectly without any issues. And then on the right side, you see that the high blood pressure is causing much more of a stiff and narrow blood vessel. And you can see that the blood vessels are more clumped. So what this does is that this can increase your chances of having a heart attack, a stroke, kidney problems, or becoming blind. Now we'll be talking about the heart disease risk factors. As you can see, we have high blood pressure, high cholesterol, cigarette smoking, diabetes, overweight, obesity, physical inactivity, stress, excessive alcohol intake, and family history. Now, there is a lot of risk factors. However, some of these risk factors we can control and we can take charge. For example, starting off with cigarette smoking. This is something that if we take the initiative, if we try to stop smoking, this can have many health benefits and of course reduce the risk of heart disease. Then you have overweight, obesity, and physical inactivity. This goes hand in hand simply by walking 30 minutes a day or doing some stretches around the house or taking your dog for a walk. Not only this will increase your physical activity, this will increase more blood to go into your body, and also this will also result in weight loss. And of course, managing stress. I understand, us living in New York, we're stressed every day. And especially with what's going on, we're during a pandemic. One way is if we're able to manage our stress, that will definitely help ease the pressure on our heart and reduce the risk of any kind of heart disease. So in this slide, we basically have just a basic general understanding of the blood pressure category. So you see we have normal, we have elevated, then we have high blood pressure, hypertension in stage 1. Then we have hypertension in stage 2, and then we have hypertensive crisis. And when we check our blood pressure machine, right, we have two numbers. We have the top and then we have the bottom. So the range, just to make sure that we know, like, okay, you know what, it's fine, we're normal, everything's okay. The top number is called systolic. If you have less than 120 and the bottom number is diastolic, and if you have less than 80, this kind of gives you an understanding like, okay, you know what, my blood pressure is fine, I'm good to go, no problem. When you see you're 120 to 129, and then you have less than 80, which means it's a little elevated, then, maybe a slight concern, like see why is it a little high? Maybe you had a stressful day, but that could probably cause it. And then when you reach your high blood pressure stage 1, 130 to 139, and then you have 80 to 89 for your diastolic, then it is a concerning matter. And this is, I would say, definitely contact your medical provider and explain to them what's going on. And of course, informing them of your blood pressure numbers. Of course, when you're stage 2, 140 or higher, or 90 or higher is of concern. And the last, which of course we do not want to reach that stage, is the hypertensive crisis, which is higher than 180 and then higher than 120. If this happens, please do not wait. Contact your medical provider, go into the emergency room and find out exactly what's going on to prevent any kind of bad effects on your body.
Some possible signs and symptoms of high blood pressure. When blood pressure has reached extremely high levels, you may experience headaches, anxiety, shortness of breath, nosebleeds. High blood pressure is known as the silent killer, and it often has no symptoms. That's why it's very important for you to get your blood pressure checked as often as possible.
Just a quick story. I was asking questions. One of the things that we asked at HHAP, questions, like, do you know when your blood pressure is high? And I was talking to a participant, and she said, oh yeah, I know when my blood pressure is high because I get headaches, and I know when my pressure is high. I said, okay. And I took her blood pressure, and her blood pressure was like 180 over 90, something like that. It was extremely high. And I said, are you experiencing any symptoms? And she said, no. I said, see, and as Alberta just pointed out, it's known as a silent killer because sometimes it does not have any symptoms. So your blood pressure can be extremely high and you don't know. So don't always just go by these signs like, oh, I know when, people say, oh yeah, I know when my pressure is high. Sometimes you don't. Sometimes, it can be high, and like this woman, she had to go to the emergency room because her blood pressure was extremely high and she had no symptoms of it.
Some signs of a heart attack. Chest discomfort. Most heart attacks involve discomfort in the center of the chest that lasts for more than a few minutes, or it may go away and then return. It can feel like uncomfortable pressure, squeezing, fullness, or pain. Discomfort in other areas of the upper body. Symptoms can include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Shortness of breath. This can occur with or without chest discomfort. Some other possible signs, including breaking out in a cold sweat, nausea, or lightheadedness. And again, please note, men and women's symptoms, most common, as with men, women's most common heart attack symptom is chest pain, angina, or discomfort. But women are somewhat more likely than men to experience some of the other common symptoms, particularly shortness of breath, nausea, vomiting, and back or jaw pain. Some participants in another program that I had told me they knew when they were having a heart attack, and they called 911 because they had the pain, not only the discomfort in the chest, the arm, and the gums. And they knew that they were having. So like I said, men and women are different. They have different signs. If you feel discomfort, we may, it may feel like indigestion. You have indigestion. If you have that more than a couple of hours, it's best that you get on the phone and call your healthcare provider if possible, and let them direct you, particularly during the week if this happens, because too many people have had this and did not pay any attention to the symptoms.
I used to do echocardiograms, sonograms of the heart, and this woman had came in and she had said that she was at home and not feeling well. It was a Friday night, as Alberta just mentioned, it was a Friday night. And she said she just felt not well. And she sat down and she called her doctor, and she was telling her doctor, he said, okay, come in on Monday. I'll see you on Monday morning. And then she said, before she hung up, she said, "Oh, by the way, my jaw is hurting. I feel like I have a toothache." He said, "Go to the emergency room right now. You may be having a heart attack." So had she not said about the jaw pain, he told her to come in and on the next, the Monday. So anything could have happened. She could have had a stroke. She could have had a heart attack. She went to the hospital, and indeed, she was having a mild heart attack. So it was important, as Alberta pointed out, that you speak with your doctor. I know it was a time when I was having severe chest pains. I was like, "Well, what's going on? Am I having a heart attack? What's going on?" I drank some ginger ale and burped, and then I was fine. It was just gas. But that can happen. But you have to be mindful of your body. If you're not feeling well for some reason, it just doesn't feel right, you're having chest pain and some of the other things, call your doctor right away. It doesn't hurt to call them and find out, if you should go in or not.
Okay, how to spot a stroke, called the FAST method, FAST. F, face drooping. Does one side of the face droop, or is it numb? Ask the person to smile. Is the person's smile uneven? A, arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? S, speech difficulty. Is speech slurred? Is the person unable to speak or hard to understand? Ask the person to repeat a simple sentence like, "The sky is blue." Is the sentence repeated correctly? T is time to call 911. If someone shows any of these symptoms, even if the symptoms go away, call 911 and get the person to the hospital immediately. Check the time so you'll know when the first symptoms appeared. Beyond the fast, other symptoms you should know: sudden numbness or weakness in the leg, sudden confusion or trouble understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or loss of coordination, and or sudden severe headache with no known cause. How to take care of your heart. Taking care of your heart. Aim for a diet rich in fruits and vegetables, whole grains and fibers, fat-free or low-fat dairy products, beans, lean meats and poultry, fish, not necessarily fried fish, omega-3 fatty acids. Engage in physical activity 30 minutes per day. And sometimes you don't have to do the whole 30 minutes. You can break that up into 10-minute increments. 10 minutes now, housework, 10 minutes walking around maybe a hallway, as long as you get at least 30 minutes. And very, very important too, to me, it's like at the top of the list, taking your medications as prescribed. Because a lot of participants that I have come across, they do not take their medications as prescribed. For many different reasons, they were not taking. It said it made them feel sick, et cetera, et cetera. And if you are having issues with your medication, you should definitely talk to your healthcare provider. And just as important, quit smoking. Limit food high in sodium, salt. That's another one. Saturated and trans fats and added sugars. That's why in the HHAP program, we teach people how to read labels and look out for the hidden salt and sodium. You would be surprised at especially sodium and even sugar, how they sneak it in. So that need to be counted in as your total overall daily intake. Million Hearts ABCs. A, aspirin use if your doctor prescribed that. B, blood pressure control. Always know what your numbers are. C, cholesterol. Another, know what your cholesterol levels are. S, quit smoking. And definitely in the HHAP program, when we enroll people into the program, the next thing we ask, what are their goals? And a lot of times they do say, it is controlling my blood pressure. So we make that as a goal. Discuss your blood pressure, cholesterol, and weight goals with your healthcare provider, or if you're in our program, us as well. Always, write down what your blood pressure numbers are, what your cholesterol is, and what is your weight goal. Take medications as prescribed. Don't skip any dosages of your medication. Take it as prescribed. You will ask your healthcare provider which meds are to manage my blood pressure. Know your medication, so that way you don't mix them up with some other, maybe over the counter. Ask your doctor how you should take your medication, when you should take it, and how often you should take it. And again, monitor your blood pressure. Most people do have a home monitor. Others, their insurance providers will assist them in getting one. If not, some of the area pharmacists has it. So always try to monitor your blood pressure as many times per week as your healthcare provider has suggested to you. Again, we have to caution people how to prevent the spread of COVID-19 in New York City. Take these steps. Stay home if you're sick. Wear a face covering. Keep physical distance. Keep your hands clean. Get tested. We all have to take care of our mental health, and particularly during these trying times. So New York City has always stepped up to the plate. There is a New York City hotline available free of charge to anyone experiencing problems with stress, depression, anxiety, or drug and alcohol use. New York City Well, talk, text, chat 24/7, 24 hours a day, 7 days a week. And also, you can contact our program, the Harlem Health Advocacy Partners Program. We have a licensed certified social worker that lead our meditation and support classes, meditation Mondays at 11 a.m. and support on Wednesdays at 11 a.m. via Zoom.